And welcome to the Dr. Bob Show. Are you bothered with a sensitive stomach, a sensitive belly, a sensitive gut? Do you have abdominal pain? Do you have cramps? Is it something simple? Could it be due to reflux? Could it be due to gallbladder disease? Could it be due to appendicitis? Could it be due to Crohn's disease? Could it be due to cancer somewhere? Or is it something where our stomach is just not acting right, like butterflies in your stomach? We'll be spending most of the show talking about that. My guest is Dr. John Haydek. Dr. Haydek is a board-certified stomach specialist, gastroenterologist, and he'll be answering our questions. Hello, I'm Dr. Robert Overholt. I'll be your host for the next 30 minutes on the Dr. Bob Show. Later on, we'll be talking about early morning headaches. Do your headaches wake you up? Or do you wake up and then have headaches? There's a big difference in that. Peanut allergies, they're on the increase. Can they be part of your life, and can they be cured? We're talking with Dr. John Haydek, board-certified gastroenterologist, and we're talking about a sensitive gut. John, welcome to the Dr.
Hi, Dr.
Bob Show. Tell me, is that a common complaint in the GI office? My tummy just doesn't feel good. I know there's nothing wrong, but it is wrong and it bothers me.
You know, it's extremely common. People don't really come into the office saying, I have a sensitive gut. They come into the office saying, it just doesn't feel right. My digestion is off, or I feel bloated or full, or it just doesn't feel right.
Common?
Very common. Gosh, well, since it could be caused by so many different diseases or conditions, it's probably one of the most commonest thing we see.
So run through, just not through the diseases, but just name me 5 or 6 things that can cause a sensitive
gut. Having an irritable bowel or a spastic bowel. Having sugar intolerance. We know about lactose intolerance. There's another sugar, fructose, fruit sugar intolerance. That can cause trouble. Food allergies like celiac disease can do it. And then there's more worrisome things like, say, Crohn's disease or celiac disease, things like that.
Let's talk about irritable bowel. What does that really mean? An irritable bowel just means it's irritable. Is that a disease process?
I think it's not really a disease so much as a list of symptoms that go along together, and we call that something. An irritable bowel or a spastic bowel is just an irritability in the intestines to where they just don't work the way they should. It's not that there's anything wrong. There's no inflammation, there's no blockage, there's no tumor. They're just irritable. Some days they're good. Some days they're not. Some days things work perfect, and some days they not. Very frustrating for patients because they can say, I ate that food, Dr. Haydek, and God, was I bloated and full, but I ate that same food 24 hours later, and it was great.
So what's going on?
Well, it's just an irritability in the nerves and muscles that just don't function in there. You know, our bellies is really a brain of itself. If you took our intestines out and put it on a table, they'd work. They don't need our brain to do that. They can work on their own. And there's a lot of research going into why that happens. One of the biggest problems with irritable bowel is you can't prove it. You can't do a blood test. You can't do an x-ray. It's just a list of symptoms that go along with that condition.
Do they have more diarrhea? Do they have more constipation? Is the belly pain in a certain area?
Well, I guess there's different types and subtypes. There's IBS diarrhea. Those patients wax and wane from normal to diarrhea. There's IBS-C, constipation. They wax and wane. Sometimes they're normal, sometimes they're constipated. And then there's the mixed variety where they go back and forth. They'll have 2, 3, 4 stools one day, and then nothing happens for 4 days. That's very frustrating. And the irritable bowel pain usually is in the center, right around the belly button, but it really can be anywhere.
How do you diagnose it?
Well, it's tough. It's tough. You look for a list of symptoms that is abdominal pain, bloating, with an altered bowel frequency or consistency.
So if you're not sure what it is and there's no blood work for it, do you have to look down in the stomach or do you have to do colonoscopy on that?
Well, I guess irritable bowel is really common. 1 out of 5 people have it. And almost always...
1 out of 5?
1 out of 5, 20%. Almost always you can diagnose it clinically. The problem is that it's really hard to know the difference between celiac disease or irritable bowel. It's really hard to know the difference sometimes between sugar intolerance, fructose intolerance, or Crohn's disease and irritable bowel. We have great treatments for celiac and fructose intolerance and Crohn's. We don't got too many good ones for irritable bowel syndrome. So a lot of testing. How do you treat it? Well, a lot of testing helps you say, is it or isn't it anything concerning? The way we treat it is usually a 3-step thing. We try to look at common foods that cause trouble, gas-producing foods, beans, broccoli, cauliflower, cabbage. We try to avoid milk products because many people with irritable bowel are lactose intolerant. And then we try to avoid the obvious triggers for them. And it could be peanuts, it could be gluten, it could be chocolate. And you just try to look at the diet, keep the bowels regular and soft. And sometimes it's just reassurance. They're scared. They feel they do have a blockage or celiac disease or cancer. Sometimes just reassuring them is what you need to do.
So tell me about lactose or lactose sugar intolerance. That's part of the diagnosis there. What is lactose intolerance? What does that mean?
Well, it means that when you ingest lactose, which is milk sugar, normally your body digests it, sucks it into your body, and then uses it for energy. People who are lactose intolerant can't absorb lactose.
So what happens to it?
It goes into the colon.
And when it goes into the colon?
Oh my gosh. It's a bacteria loves the fact that you're not absorbing it, so they can use it and digest it themselves, which forms gas and bloating, and it changes the bowels there.
So you've got gassy abdominal cramping pain with the urge to purge after drinking milk or lactose sugar.
Exactly right. It takes a little time, though, for that milk to go from the stomach, intestines into your colon.
How long?
So, well, we're all different. Some people it'll take 30 minutes. Some people it'll take a couple hours to go through. So probably an hour or 2 or 3 is when you usually see it. Those patients who eat and within 10 minutes have to go to the bathroom, that's more irritable bowel, because we have a reflex called the gastrocolic reflex, stomach colic. You eat, sends a signal to your colon, food's coming down, you better empty. And that reflex can be very strong in people who have irritable bowel syndrome.
John, celiac disease fits in here, but it's an hour program. Briefly, tell me about where's celiac disease? Does this cause diarrhea, constipation, and why? In 1 second. No, in a couple of minutes.
Celiac disease, gosh. Celiac disease, the vast majority of celiac disease have no symptoms. That's the problem. 1 out of 250 people have it. The majority of people really don't even know they have it. Some people have the obvious diarrhea, bloating, and gas, but the majority don't. You find out they have celiac disease when they get low on iron because they can't absorb it, or when they get osteoporosis because they can't absorb the calcium. The falsehood is that everybody with celiac disease has diarrhea and weight loss, and that's not the case.
So what's happening with it? If they have a gluten sensitivity, they can't eat wheat, what happens to the small bowel if they eat wheat?
Well, if you're gluten intolerant, it'll cause usually bloating and fullness that causes fluid to go into your intestines, which causes them to swell some and distend, and that feeling is just uncomfortable.
The treatment?
Well, if you're gluten intolerant and you don't have gluten, you're normal. You're not abnormal. You're perfectly normal, except when you take gluten.
So you just have to avoid it, and it's as simple as that.
And they're completely normal people. They just have an allergy.
The diagnosis is by blood work, or the diagnosis is by small bowel biopsy?
Because the treatment is so hard, lifelong gluten avoidance, because of that, almost always we push for a scope test to prove it after blood test gives the suggestions. Other countries may not have the luxury of doing scopes, but if blood work's abnormal, almost always you push for a scope because it's very hard to avoid gluten. It's a common thing in our society.
John, what I'm hearing is people have problems. They can be worked out. Are there other GI problems that cause a sensitive gut?
Well,
And that's what we're going to be talking about when we come back. There are a lot of problems that can cause a sensitive belly, a sensitive gut. A lot of information for you. We'll be right back. We're talking with Dr. John Haydek, great teacher, board-certified gastroenterologist. We've been talking about an irritable gut, a sensitive belly. 1 out of 5 people have it. Constipation, cramping, bloating pain, sometimes diarrhea. May come on for 4 days, then go away for 4 days. The same foods you eat one time doesn't bother you, the other times it does. Hard to have a diagnosis. We talked about lactose intolerance, where there's an enzyme lactase that doesn't digest lactose and it lets the bacteria, gas-forming bacteria, cause cramping, abdominal pain. Now we're going to keep on going, or I'll talk all day on this. John, what else comes to your mind if somebody comes in and just, my gut's just driving me nuts?
2 things other than what we've talked about. One of them is something called small bowel bacterial overgrowth. It's something we're seeing more and more, and we're not sure why, other than we're diagnosing it sooner. That's where the bacteria from the colon sort of migrate up into the small intestine.
Wow.
And they can sort of interfere with digestion. They can cause more gas and bloating. The other thing we always have to keep in our mind is inflammatory bowel disease, not IBS, irritable, but inflammatory bowel disease. That's like colitis and Crohn's disease and ulcerative colitis. That's a little more dangerous. They tend to look a little more sicker, but mild cases you really can't tell.
So what is ulcerative colitis or regional ileitis or inflammatory? Not irritable, inflammatory, inflammation bowel disease.
Exactly.
Talk to me a little bit about
That's
it.
more of a genetic abnormality where for some reason, we don't know why, the body begins to attack itself and it sees itself as abnormal. Those patients can get very sick. They tend to need an aggressive treatment course. Thank goodness for 2015, we have great medicines now that we never had before.
What are some of the newer things we can do for somebody with inflammatory bowel disease?
There's something called biologics, Remicade, Humira, Cimzia, and there's new ones coming out too. They can really work well to modify the immune system, sort of arrest the inflammation and sort of help things calm down.
So, in my understanding, when we treat those, it's monoclonal, so it's antibodies that are produced against tumor necrosis factor, which is the factor that's causing the inflammation. How successful is that when you do that?
Unfortunately, it's not 100%. Maybe 50% of people who get it really do well, but medical technology is working. We now have what's called endocrine blockers, where they actually prevent white blood cells from exiting the blood vessels into the inflammatory
Wow,
areas.
so the white blood cells cause inflammation, so if they don't get there, you don't have any inflammation.
Exactly right. So things are really progressing well for those patients, things we've never had the ability to do now.
So when you have a patient that's got that serious illness, Crohn's disease, ulcerative colitis, and the new medicines, how does it feel when you get cures where, we didn't have this 10 years ago?
I agree with you, we didn't.
So what's it like now?
Their life is back. They feel well. The hardest thing is the cost, and the hardest thing is the risks involved. These are big time medicines that have risks of cancer and tuberculosis, and it scares us normal people. But if you went to someone with colitis or Crohn's and you said, I have a possibility of making you normal, but there's a risk of this, the literature has proven that those patients say, I want quality and I want my life back. Even though it's risky, I'm willing to do that.
So the benefits outweigh the risks. When we look at television ads, we see they all say it could cause this, 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 and this, and so who would take that? In general, if you're guiding the patient with these serious medications, can you keep a good enough eye on them where they'll do well, like tuberculosis, you get the chest x-ray from cough, fever, chills, Can you do a good job
Yes.
of guiding against those risks?
Because everything's done now in a systematic fashion. Nowadays, medicine is getting more toward cookbook medicine rather than the doctor just using its judgment. There's guidelines, there's care paths that we follow. Everybody on biologics get a TB test once a year. They get blood work every 6 to 12 months. They get office visits. So it's so much different than in the old days where you just trusted the doctor to do his job. Right now, the doctor is helped by these guidelines to help be sure things go in the right direction.
That must feel so good.
Yes.
To see people that develop a quality of life. So let's talk about any other thing that comes to your mind on a sensitive gut.
Now, other than the small bowel bacterial overgrowth, that one is actually can be pretty, you can miss that unless you look for it. And the other one is fructose intolerance. We sort of hit on it a little bit. Like lactose, fructose is a sugar, and if you don't absorb it, it can go into your colon and cause gas and bloating and diarrhea. A third of people with irritable bowel, they don't have irritable bowel. They have fructose intolerance. Take out fructose, they're normal, perfectly normal. It's just how many tests can you put the irritable bowel patient through? And that's why the hardest thing about irritable bowel is the unknown. You just can't diagnose it with assurance.
When somebody comes in with a bad gut, an irritable gut, a sensitive gut, a bad colon, abdominal pain, I would think you have to evaluate that endoscopy-wise. You have to look, you have to do a colonoscopy. Is that pretty much, I can't imagine if somebody comes in with a sensitive gut that wouldn't be part of the workup.
Yeah, I guess it's all about degree, how sick they are, and it's looking for warning signs that make you say, wait a minute, this isn't just a simple irritability. Anemia, blood in your stool, weight loss, vomiting, new onset in an older age. Most irritable bowel starts when we're young, in teens and 20s. So if they have those warning signs, yeah, they're going through testing. It may not be scoping everybody, but they're going through testing to find out. But if I have a 19-year-old who comes in with classic symptoms without warning signs, no, they get a pat on the back. You talk about the warning signs to look for. You talk about the treatments, and you sort of see how they do, because almost always you could talk those patients through better lifestyle changes, and they do better.
John, when you talk with patients about looking down the stomach, an EGD or colonoscopy, they all say, I really don't want to have to do that. But after you talk with them, after they've had it, you say, well, now what was it like? And they said, I didn't know anything went on.
That's exactly right.
Another one told me it's like a 45-minute nap. And so really, you wake up and say, when are you going to get started? And then you realize they've done it.
Right.
How do you tell the patient that they're fine?
I guess in 2015, you can, with the medicines we have nowadays, you can almost look at them and almost, not always, almost always guarantee that, you know what, it'll be painless. You'll wake up, you won't have a sore throat, you won't even know it's there. They don't have the gas trouble, the nausea, the vomiting we used to have before. And by assuring them that they're going to be okay, they're not going to have the nausea and vomiting afterwards, you know what, they don't mind going through testing as long as there's a good reason for it. They don't mind at all.
John, what do you see in the future of gut in medicine? Do you think that diagnosis will be different? Do you think treatment will be different? I know it will be, because 10 years ago, we weren't as good as we are now, and I know 10 years from now we're going to be better. Any thoughts?
You know, Dr. Bob, we used to have hepatitis C, and they brought hepatitis C to the drug companies and said, we want a cure. And within a short period of time, we have one pill, once a day, 3 months, almost no side effects, 100% cure for hep C. For irritable bowel.
Huge difference.
For irritable bowel, once we find a diagnostic ability where we can say, yep, here's the problem, it's going to go to the drug companies, and I'll bet you they're going to come up with a cure. It's just a matter of finding why we get it, and they're working on it, Dr. Bob, they're working.
John, you and I could talk all night. I love talking with you because you've got such a plethora of knowledge. We had to use a big word in there. And you're so much fun.
Thanks, Dr. Bob. Thank you.
To teach people with. Thank you for coming to the Dr. Bob Show.
You're welcome.
Wasn't that fabulous? If you've got GI problems, know that the diagnosis and maybe cure is there for you. Now you're going to want to stay tuned. We're going to be talking about headaches in the morning. Does the headache wake you up in the middle of the night, or do you wake up and then get a headache? Huge difference. You'll want to stay tuned. A lot of information for you. I want to thank Dr. John Haydek. Wonderful discussion for that sensitive gut. And now for questions from you, the viewer, that I think will be important to your health. Dr. Bob, I have headaches in the morning when I wake up. What could be the problem? Well, there's two problems with early morning headaches. If your headache wakes you up in the middle of the night because of pain, it can be serious. That could be something bad. It could be that people are having nighttime migraines, or it could be even a brain tumor. So if your headache wakes you up, it could be that you've got problems with the blood vessels inside the brain, or it could be a tumor that's getting bigger and bigger that wakes you up in the middle of the night. Serious? See your doctor on that. Early morning headaches? Serious. If you wake up every morning and you have a headache after you wake up, what are some of the causes? Well, let's think about it. Why would we have a headache when we wake up in the morning? Well, could be we hadn't had a good cup of coffee, because caffeine will open up the blood vessels in the head and give us better nourishment to the brain. Brain uses more oxygen than any other organ. So what about obstructive sleep apnea? If people lose their breathing for 5 or 10 seconds frequently during the night, that's obstructive sleep apnea. Then the oxygen level gets low. The oxygen level in the brain is low. People wake up with a headache in the morning. So early morning headache, if you're snoring, you probably have obstructive sleep apnea. And that can be very, very serious. Not only do you have early morning headache, but when you stop breathing in the middle of the night for 5, 10, 15 seconds, also the adrenal gland tries to wake you up. So we get high blood pressure, we get heart rhythm problems. So it is a real, real problem. We can wake up in the morning and even have sinus headaches. Sinus headaches can be when we wake up and we lean forward to tie our shoes. The blood goes to the front of our head. When it goes to the front of our head, if we've got sinus infection, it starts to hurt right then. Those are people with stuffy nose, pressure around the bridge of the nose or on the forehead. And usually they're blowing out yellow or green, discolored nasal exudate. All of those are abnormal things. Tension headache can occur first thing in the morning. Some people that just have 2 tenths of life, they just have to learn to live with a headache in the morning. There are medicines and there are things that you can do with that. If you have early morning headache that's steady, that's not throbbing, that's not on one side, that is not in the sinus area, be sure you talk it over with your doctor. If it's a tension headache, there are medicines that can help you, and if that headache's gone, you don't have pain, it makes you a better person and easier to be happy. Question number 2. Dr. Bob, I'm afraid of peanut allergy. Is that a correct fear? Well, peanut allergy is on the increase. That's the first thing that we have. 50 to 100 people die each year because of peanut allergy. So the fear of getting a peanut allergy for a mother with a young baby is very significant. We usually do not get peanut allergies later on in adult life. Anything can happen. In childhood, if you get peanut allergy, you rarely lose it. So what about a baby that's prone to have allergic food problems? Somebody with eczema, they frequently have food problems. Should I avoid peanuts? Should I stay away from peanuts? Is that the best thing to do? Well, there's a new study called a LEAP study, L-E-A-P, and what it says is, in a guided circumstance, hopefully in an allergist office, in somebody that would have a high incidence, a high chance of having peanut allergy, they can actually do some skin testing, and depending on the skin testing to peanut, they actually challenge at an early age. They start introducing peanuts at age 8 to 11 months. So know that and that will help prevent those children from getting peanut allergy. Well-performed study. So know that if your child is prone to have food allergies, if they have eczema, if they have egg allergies, that you need to check with your doctor about preventing peanut allergy from occurring. It could be a life-changing thing. Well, all the time that we have for this show, remember those 4 things that we like to do in the Dr. Bob Show. Exercise. As I look at medicine over the years, exercise is the best thing that we can do. It reduces stress. It can lower our blood pressure. It can make us lose the weight that we want. We feel better with a runner's high. It will help digest food. It will help us sleep easier. It will make people with type 2 diabetes make the blood sugar be utilized so the blood sugar will come down. Be sure you're exercising. Start the day off with 7.5 to 8 hours sleep. Boy, does that make a difference in life. You'll be happier, you'll be healthier. If you're not sleeping well, learn how to sleep well, and if you can't see your doctor, you may even need a sleep study. Eating properly, you know, we're learning more and more. We're doing a good job. Eat good foods, more fruits, more vegetables, less food. Don't not eat. And most of all, what do we like on the Dr. Bob Show? It's that laughter in your life. Find somebody to laugh with, laugh a lot, smile, goof off, and you'll be healthier.